Now, we're going to go into the University of Health right now. As Charlie Shields stated at the beginning of our program, there are a wide array of jobs available for young people today. We're going to get to learn about biomedicine at University of Health. Now, myself, I'm not a big fan of blood, but after learning what the University of Health team does day in and day out, changed my mind a little bit. Let's see inside University of Health in Kansas City.
4, 3, 2.
Welcome to University Health in Kansas City. We are an academic medical center, which means our doctors and nurses teach the healthcare providers and leaders of tomorrow. University Health has 2 acute care hospitals, our main campus in downtown Kansas City and our Lakewood location in eastern Jackson County. Our services also include Kansas City's largest behavioral health program, a Level 1 trauma center, a Level 3 neonatal intensive care unit, and primary care clinics across Jackson County. And nearly 4,500 people are proud to work at University Health, where we provide academic medicine for all. One place where you'll find compassionate care each day is inside the Richard and Annette Block Cancer Center at University Health. If you are interested in a career in hematology, this is where you'll find many exciting opportunities.
My name is Melissa Becker. I am the Senior Director of Oncology, Hematology, and Blood Disorders at University Health. Well, hematology is basically a blood disorder that could be hemophilia, could be iron deficiencies, could be anticoagulation deficiencies or problems, when your blood can't clot or when your blood clots too much.
Anticoagulants are medications that stop blood from clotting too easily. They can break down existing clots or prevent them from forming in the first place. These medications can help stop life-threatening conditions like strokes, heart attacks, and blood clots in the lungs known as pulmonary embolisms.
Mitch Sprecher, I'm a nurse practitioner at University Health, and I work in the anticoagulation department.
Mitch Sprecher plays an important role in the lives of his patients. He meets with them regularly and monitors their blood's ability to clot through tests that measure the time it takes for blood to clot.
Patients that are on anticoagulation, we want their blood to clot slower. And so we have to monitor it to make sure that it's not clotting too slow or not clotting at all. If it's not clotting, then they're at risk for bleeding. If it's clotting too fast, they're at risk for a blood clot, which can have, pretty severe impacts on their health.
Mitch typically sees his patients every few weeks to every few months. Sessions typically last 15 to 20 minutes.
We get to know them personally. It's nice to have that relationship so that they feel comfortable and that they can trust me when they come in to see us.
Just a few more minutes left on that one, okay?
Courtney Shanks also plays an important role in the lives of her patients. As an oncology infusion registered nurse, Courtney provides treatments such as chemotherapy for people with cancer.
Typical day, we see about 40 patients roughly on average in our infusion area. And out of those, I would probably have anywhere, depending on staffing, of 5 to 10 patients. We start IVs, we draw labs, we collaborate with our pharmacy with the medications that we're gonna give the patient.
Patients can arrive at the oncology clinic feeling scared or concerned about their prognosis. Chemotherapy sessions can last several hours. That time becomes an opportunity for staff like Courtney to bond with patients and help answer questions, ease concerns, and provide a listening ear.
A lot of the patients come in scared. This is their first time ever dealing with something like this, and so we try to build trust with them, and we definitely build a relationship with them and their family so that they feel comfortable whenever they're here.
At University Health, we always look to attract the next generation interested in healthcare. Our Career Connections program provides a pipeline to future opportunities. The Teacher Externship Program, the first of its kind in the state of Missouri, brings teachers from the classroom into the hospital where they learn about career opportunities for their students.
For whatever reason, a lot of people aren't exposed to healthcare professions. They think this is all just about being a nurse or a doctor. Well, there's a lot of other jobs out there. They're not only well-paying jobs, but they're very rewarding jobs. Career Connections is designed to build that pipeline of our staff of the future, and that pipeline goes all the way down into elementary schools.
Tony Fletcher is a phlebotomist. Her job is to draw blood from patients.
The blood can tell you basically everything that's going on with your body. That is why the doctors put blood work in, so we can draw the blood and send it down to be tested for whatever test that the doctor may want ran on it. So I just like being able to be part of, helping people get better.
At University Health, our mission is to provide academic medicine for all, regardless of the ability to pay. This mission attracts the brightest minds and the biggest hearts in healthcare.
Helping others it's always a beautiful thing.
And if you're part of the next generation thinking about a career in healthcare, our providers offer you this advice.
Just take your time and explore, and don't say no to one thing. You might think, I don't want to do that, but it might be your favorite area that you've ever worked in.
I think opening your mind to as many different avenues as possible is important to keep, a broad perspective on education.
Fantastic. And I see we have live with us the team from University of Health that you just saw. Melinda, Mitchell, and Courtney are joining us live from University of Health in Kansas City. Thank you, team. Welcome.
Hi, thank you. Good morning, everyone. I'm Melinda Kimmel. I'm the Associate Director of Education at Career Connections. And I want to personally thank each of the 6,000 students and teachers across Missouri for taking time to join us. Our goal is to help each of you get to know more about the great work we do here at University Health, give you a better idea about careers in hematology and oncology, and highlight some of the many opportunities available to you here at University Health as you look beyond high school. University Health is a safety net hospital. That means we do not turn anyone away. Our providers care for those with the best private insurance and those who have no insurance. We're also an academic medical center. We like to say we provide academic medicine for all. We have many exciting career opportunities, both clinical and non-clinical, available for the next generation like you. As you saw in the video, Career Connections is about attracting those who are interested in healthcare. Participants in our career pipeline program can receive free education and training, as well as many great exposure to many career paths that can be found in hospitals. You can easily transition from apprentice to employee after completing one of our programs. You just need to be 18 years old and have a high school diploma, GED, or equivalent. A few opportunities we haven't included are medical assistance apprentice, unlicensed assisted personal training programs, certified nursing training programs, and more to come. To learn more about Career Connections, go to our website, universityhealthkc.org. Now I'd like to introduce you to our guest, who you met in the video. Mitchell Sprecher is a senior APRN in the anticoagulation clinic. But first, I'd like to introduce you and start with Courtney Shanks, a registered nurse in our Hematology, Oncology, Infusion clinic. Courtney, I'd love for you to answer. Can you tell me what drew you to this important work?
I knew at an early age that I wanted to go into working with people when I got older. So I originally started in psychology, and I decided I wanted to work more on the medical side of things. So I just love working with people, and I love the connections and the relationships that you build with them. And it's just a passion of mine.
Yeah. Before working in oncology, you were in labor and delivery, helping deliver babies. Why did you switch from helping new moms to treat patients who are living with cancer?
Again, kind of going back, I have had an interest in oncology even before I went to nursing school. I had a family member that had cancer, and so when I was little, I was like, I want to take care of patients that have cancer. And I just kind of fell in love with labor and delivery in nursing school. So that's kind of where I started. And I loved my time there, but I knew I wanted to move on to something different. So I started floating around to different clinics, and oncology kind of took me under their wing, and I fell in love with the staff there, and the patients, and I haven't left. I absolutely love it.
That's beautiful. What advice would you give to someone who is interested in healthcare?
I kind of said a little bit in the video, but I would just explore, take your time, looking into what areas you're interested in. When I went into do my clinicals in nursing school, I didn't really, love or hate one thing or another, but I just kept an open mind, and I was like, let me just learn as much as I can from each of these different departments, and you'll just take your time and really explore the different areas that you can go into. There's so much that you can do in the healthcare world.
Thank you for sharing a little bit of your journey. Mitch.
Hey.
Hi. To anyone who's watching, who's not heard of anticoagulation department like me, can you explain this in simple terms?
Yeah, so basically my job is helping people manage their anticoagulation, which is if someone that you know gets a blood clot, for a short amount of time, they have to be on a medication that helps their body not get further blood clots, but also not have the blood clot get any worse. So I help them manage the medication and make sure that the levels in their body is correct while they're on it.
Thank you. How many patients do you see? How often, and how does your care help them?
Yeah, so typically in a day, I'll see anywhere from 15 to 20 patients a day. And the nature of our clinic, I see my patients a lot more frequently. So I'll see a lot of the patients every 2 weeks, 4 weeks, and up to like 12 weeks. And it's kind of a little bit different than some clinics. And so I get to see my patients a lot more frequently, which helps build, that relationship, and, they can feel like they can trust me in all of the medical decisions.
Really nice.
Yeah.
So can you talk to me about your education path and the advice that you would give anyone concerned about the cost of higher education?
Yeah, I think that's a really important discussion, because I think college can be very overwhelming as far as costs and, how to go about financing that. So I got my doctorate degree in nursing, but I worked at a hospital while I did that, and they were actually able to pay the cost of tuition for me, which a lot of hospitals have programs that will pay for your degree as you work there. And so, there's so many options. You can go to a 2-year program, a bachelor's degree, which is a 4-year program, or you can, just start, as a CNA and work in a hospital, and then have, hopefully they have a program that they can help pay for some of your tuition. And I think that's a great option to help with the cost of college as it increases.
Thanks for sharing about that journey. So Mitch and Courtney, thank you both for your time, your talent, your expertise today. And if you want to see firsthand what it's like to work inside a hospital, we make it possible through Career Connections for teachers to go with our team, bringing high school students to University Health for tours and other virtual opportunities. Again, you can go and visit universityhealthkc.org. And now we're going to send it back to Ryan.
Okay. Hey, thanks so much, team. We have some questions coming in now, and we'll go to Portageville, I believe, is ready to go live with a question. Portageville, if you can unmute your mic and your video. Okay, sounds like they're having some technical difficulties down in southeast Missouri. We have another question that came in. Wright City Hosa asks, how do you help patients with their overall fears of testing and the devastation of the diseases they encounter? Good question.
Who wants to take that?
Yeah, I think the most important thing to help patients cope with a lot of the reasons they're in the hospital is just education. Providing them with the resources that they can learn more about everything themselves, but also, giving them education while they're here so that they can feel empowered to make decisions about their healthcare, while they're here.
Great. We have a that's a great answer. Thank you. We have one more, and this is really gets into how much school do phlebotomists have to go through?
How much school phlebotomists have to go through?
Yes.
I'm not sure. I think there's local programs.
Oh, sorry. It's so there's training for phlebotomists where it's an 8 to 10 day program. So it is a very quick training program, and you get that hands-on experience and are able to be working in a healthcare facility.
So one other question came through. St. Louis Public Schools asked, what is the most rewarding aspect of your job?
For me, the most rewarding is just working with my patients and having the relationship and the connection with them. And just seeing the happy moments, oncology can be difficult, for anybody to go through, and just, having the little successes along the way and being there for those moments. I just love the connection that we have with our patients.
Fantastic.
Yeah, for me, there's a lot of different ways that you can help people, and whether that's using the education that you've learned throughout your training, or just by listening to a patient. A lot of times, patients just want to be heard, and you can help them in that way too. So I think it's important that, for me too, to be able to help in multiple ways.
Fantastic. We actually have Portageville coming in. It looks like they can unmute their sound and video. We're going to try this again. They really want to ask their question. Oh, feedback there.
Hi.
Hi.
What was the hardest part of going to school?
Ooh, good question, Portageville.
Yeah.
For me, the hardest part is just juggling all of the classes that you're taking all at once, but just learning how to study, that's going to be beneficial for you, and knowing how your study style is and how you learn best is going to make you the most successful in school.
Any advice from you, Mitchell or Melinda, on that one? Not as good a student as Courtney there, huh?
Applying what you're learning in the classroom to like a clinical situation. It's easy to read about, healthcare and medicine and nursing in a textbook, and sometimes it's not always the same when you go into a clinical situation. So just being able to apply it to practical situations, I think, is sometimes challenging, but I think it's also rewarding to learn in the classroom and then go into a hospital or a clinic and apply what you learned. It's a rewarding process.
Fantastic. Great. We have time for one more question, and then we're going to go ahead and zoom on out. How important is patient and caregiver relationships to the overall experience? Came in from a student out there.
It's very important. I would say that's almost the number one thing, besides educating your patient on why they're there and, all that. I think it's the most important thing is to have that relationship with them, because that builds the trust with them, and it makes them feel more comfortable and willing to come back. I think it's very important.
Yeah, absolutely. I think that trust and relationship building is one of the most important things we can do for our patients, because we can have all the knowledge and all the right answers as far as medicine goes, but our patients don't trust us. They're not going to want to follow through, and they're not going to want to act on some of the advice that we're getting. So we really need to build those relationships, which is a rewarding process, I think.
Yeah, I think, that came through on the video segment for you, Mitchell, with your patient that you're working with right there. So really that community, that relationship building, and it was said by Ashley White earlier, compassion. Having that compassion for the patients that you're dealing with, a key component to anybody in the healthcare profession. So we're going to go ahead and zoom on out. Thank you so much, University of Health, for joining us today and making Healthcare Career 2023 a success.
Thank you. Have a great day.